Hi, everybody. It is October 29th, 2021, and we want to welcome you into Coronavirus Inside the Numbers, where we take a closer look at the Arizona-based numbers as it pertains to coronavirus so that you can make the best decisions for your family and your life. We do have a ton of information to get to today, so we'll try to make our way through it all, but at the same time, offering any solutions or answers that we can to any of your questions about where to find specific Arizona-based data within our reporting systems here in Arizona. So Garrett is nice enough to walk us through some of these numbers once again. I always remind folks, Garrett, that you give a deeper dive into the numbers each day, each weekday, I should say, in the newsroom for us, but it's only once a week or so that we can update everything on here. So if there's anything we don't get to, we're going to try to circle back and get to that. Obviously, the big news of the day, it's kind of like a mixed bag of some hopeful news and some not so hopeful news and all this. One of the more hopeful things we're hearing is that the FDA has moved for emergency use authorization for the Pfizer vaccine for 5 to 11-year-olds. That would mean that about 15 million doses would be sent out immediately once this thing goes through. So we're looking at maybe like November 2nd or November 3rd. The possibility of shots in arms for this group would probably be the first or second week of November if everything stays on track. They're going to set up these mass sites like they did the last time. This is going to be going to doctors' offices, pediatricians' offices, pharmacies, and then they're talking about distribution happening at schools. We don't have any specifics on that yet. So you'd want to reach out to your doctor's office, but we're still a few weeks out on that. So we want to get to some of these numbers, Garrett, and see how things look as it pertains to the AZDHS site first.
Absolutely. So let's get that. Let's get this in. Oh, so many friendly people on the comments already. Okay, so let's talk about this. The number of new cases today, 3,691, 63 new reported deaths. So what does this actually mean? When we look at the 7-day averages of where we are at about 2,574 cases on any given day right now. And we've had a lot of fluctuations over the last week or so. And so I'm expecting to see the 7-day average move more than it does until it settles probably sometime next week. But even with that, it's about a 15% increase. And what's I don't want to say surprising about that, but what that is important is because when we look at the cases by day, and we're going to take this is the epi curve. This is the cases as they came in test positive, if you will. And we're going to look at them by week. And I want a focus on October 10th, the week of October 10th, and the week of October 17th. And I want you to notice this, 14,481 cases were reported on the week of October 10th. And today, on the week of October 17th, 16,517 cases. That is a 15% increase week over week on case numbers for the week, which is an extremely stable metric, which means that it is very likely that right now Arizona is starting another case surge. And this would also correlate with last year's time as to when we started our case surge back in the fall winter of 2020. This is about the same time we did last time. So there's a seasonality component that works with this, and it does appear that we are going, at least the first indicators that we're going into another surge.
Yeah, a disappointing thing to see. Hoping that we were a bit more past this. And I just want to pause and say thank you for the nice comments that we're getting. Dave Duncan writes that he appreciates the updates. Nancy writing that as well. Thank you for doing this. You're appreciated. Thank you for saying so. We appreciate that. You are who we are here to help.
Yes.
So back to these details, Garrett.
Someone unfortunately who believes that there's a 97% false positive rate. I think at this point they're pretty far gone in their belief system and
yeah,
can't really deal with them anymore. So please continue, Katie.
It's okay because there is a large group who have families to protect and are concerned about this 15% rise. So when we talk about this, I really want to drill down in this percent. What do we have the actual raw numbers in that? Could this winter surge be as big as the last surge? I know that it's just projections at this point, but
yes.
Do we have raw numbers for that?
The answer to that is likely not. So we're going to go right now to I'm going to take you to the University of Washington's website. This is the IHME. We use this projection several times when we're doing this show. We've used this for
Yes.
quite some time. And it's going to show, it's going to indicate that there is a surge coming and that the forecast does expect to see a surge. However, what it does also expect is that the surge will not go as long as the winter surge. So this is the sort of the graph they use for daily infections. This is the estimate they use. And you can see this is the winter surge where they believed that the highest infection, and again, this is daily infections, not positive tests. So this is an estimate on who in the state were just infected with COVID-19. You can see on the 26th, it estimated that about 16,500 people were infected December 26th, so just after Christmas. And that's their estimate for that time. But then we look down here at December 29th, which is as of right now is forecasted to be basically the peak of this next surge. And right now they believe that the infection rate will be, or the infection number, raw number, will be 9,500. So we will not be looking at the same number of daily infections in this new surge. You can see the slope is much slower. It does last about the same amount of time, about 16 to 17 weeks is what they believe is going to happen. But it will not get as bad as far as the number of cases, which means it also won't get as bad for the number of hospitalizations and deaths that we saw in 2020 as well.
So if we have 59% vaccination rate here in Arizona, I think that's what we were overall at last check, 59%. For the eligible age group at this current moment, it puts us at 69.5% vaccination rate for Arizona. So if we have 40% not vaccinated, 30 to 40% not vaccinated, we should see the surge proportional to that when we're looking at year to year. So we had nobody really vaccinated
and
last time.
In fact, there's a gentleman in the comments, Miguel, who said, I thought this vaccine is supposed to reduce this. And Miguel, it actually does reduce this. So I basically took this. This is a graphic we're using tonight, so that's why it looks like what it does on our looks
like it would for a newscast.
screen. But I put this together for tonight because I put the IHME forecast for this year, which is in blue, and the IHME forecast for the winter fall surge in yellow. And yes, you can see that it absolutely does reduce this. You can see at the peak right here, it's up here in the 16,000, and then it drops off immediately. Here we see a very gentle, gradual slope. If we did not have the vaccination numbers that we have now, with a Delta variant that is 6 times as transmissible as the UK variant that caused this, you're looking at if we didn't have those vaccination numbers, this slope would not be as gradual as it is now, and in fact, it would likely surpass the yellow slope. So because of that, the answer is the likelihood that this next surge, as I said, is going to be as bad is much smaller than we would imagine. Now, of course, there's still going to be stress on the hospitals. We're still going to be losing Arizonans, unfortunately. This is still basically baked into the math at this point. But again, if we put it into perspective and context, in the 2020 surge, as of right now, because of the vaccination rates we have, the booster rates that are coming right now, about 23,000, I believe, boosters, estimate about 23,000 boosters were given over the weekend so far. If those numbers continue, it should continue to stem this number, and we won't see sort of a massive surge. We'll see this slower surge going up.
Yeah, Miguel's saying thank you for answering the question. Thank you, Miguel, for the question. I think a lot of us thought we'd be over this by now because we thought people would actually get the vaccine. It seems wild to pass that by if you're healthy enough to get it. And speaking of which, some people now showing up for a third booster and now talk of a fourth booster 6 months later. Now, this fourth booster, I want to stress, this is for the moderate to severely immunocompromised. So this would be those of you who have cancer, those of you who are on immunosuppressive medications. That would be your group for that fourth booster that they're talking about. So it would be folks who would be, like, for instance, up at Mayo Clinic getting that booster shot for as part of their overall health regimen.
let's look at, I want to put some context to the vaccination numbers. And one of the reasons why, we see 59%. And again, this is our vaccination site at the ACDHS. This is percentage of people who have had one or more dose of COVID-19. So it's a slightly larger number than the fully vaccinated. But this is 59%, about, as you said, 59%, 60% of Arizona's population has some immunity to COVID-19. Most of them do have a full vaccination, but it's not as big. But I want to look at these ages here, so you can see the ones that are the most susceptible to succumbing to COVID-19 are the 65 plus, and you can see this number is at about 94% of Arizonans that are age 65 plus have a COVID-19 vaccine. And I would surmise that if you actually were able to break this out to 75, 85 plus, that number would be even higher. So this is a good thing, because this is the group that, as we've seen from the mortality numbers, is by far the most susceptible. Now, we do have this number right here, 77% for the 55-64. This group is not as susceptible to succumbing to COVID-19, but they're still sort of in a orange zone, if you will, that there is some danger there. As we go down the list, the numbers do get lower as far as your danger is concerned. I know that right here, obviously, this 21%, there's a lot of people in this group, this under 20, that simply are not at this point eligible for the vaccine, but I believe that that's going to be changing very soon. And so this number should at least increase closer to these other metrics over the next 3 or 4 weeks, which will push our COVID-19 vaccination rate closer to 70%, 67%.
Yeah, we'll probably likely in the next few weeks see a very dramatic change in that under 20 group. Speaking of that under 20 group, I know that we have closely logged some of these deaths, the people that we've lost here in Arizona, now more than 21,096 people, 63 reported in today, lost to coronavirus here in Arizona. Still, a couple dozen of those have been children, Garrett, people who are under 20 years old. I believe the number is like 43 at this point. And people can find those numbers broken down on the AZDHS website. There is a section for COVID-19. Then you click through to deaths, and it's broken down by age group. The age groups are the same as what you just illustrated there with the vaccinations to show it. And 15,000 of them have been that over 65 group, and diminishing down to 1,000 in the 20 to 44. You can go through the numbers if you like for yourself, but this is still a massive number of Arizonans lost. And as we look at those projections from IMHE, we're still projected to see thousands more within this year as we head into the holidays.
Yes,
it is the leading cause of death in Arizona.
We are expecting about another 3,000 to 4,000 deaths still in Arizona, coming up to about 25,000 by February. I will get into the leading cause of deaths in a moment. I did want to address at least one of the comments. Alex Sandoval asked about herd immunity, and he asked, between the vaccines and those with natural form, are we near herd immunity? That's a great question, Alex. The issue, the problem we have in the inability to answer that is that if you think of a Venn diagram, which is, the one circle on one side and the one circle on the other, and then there's a middle area, right? We know the vaccine, and if we take these two circles, we say one is vaccinated, one is we had COVID. And then there's that middle area of vaccinated and COVID, we had COVID. We don't know the size of the
overlap, if you will.
The overlap between those two. And so because of that, it makes it very difficult to know how much more does herd immunity contribute to this metric. So herd immunity for Delta variant is about 85% of the population, because it's so much more transmissible. The estimate is about 85% of the population needs to have immunity to COVID-19. And so we see by vaccination status, we know that it's about 60 to 50, 59 to 60% of people that have been vaccinated. And so, but we don't know what that extra 20% is, because we don't know the difference between the herd immunity, people who have had COVID and who's been vaccinated. So
and then the other problem in all of that, the other aggravating factor, if you will, over time, that natural immunity if you've already had COVID, wears off. In fact, a new number coming out from the CDC says unvaccinated people, unvaccinated with a previous infection, were 5 times more likely to have a positive COVID-19 test compared with vaccinated people. So these looks at this are coming out, and you're not out of the woods just because you've had it.
Yeah, it's very. I mean, I've of the doctors that I've talked to, they said the issue with all of this is that the studies are very new, and that they don't really have a handle on it quite yet. They said that they're not really sure how our T cells respond to all of this. They have the serology tests that they can check our blood for antibodies, but there's other things in our immune system that also interact and are also to counter COVID and can generate antibodies very quickly. So like I said, I've seen different estimates. I hadn't heard the one that you talked about right now, but it's very confusing right now. We're in a confusing time where it comes to reinfection and antibodies, because there's not a lot of body.
And you throw Delta in and all of that. It makes it even more confusing.
And Delta, exactly. Delta is brand new. I mean, they spent all their time writing these white papers and studies and all this stuff for the UK variant. And then Delta comes in and says, oh, by the way, I'm 3 times more transmissive than UK variant. So I'm going to change literally the entire formula. And so they had to basically change everything.
Start over.
It's way over my pay grade as far as being able to understand what the actual white papers say, but there's a lot to it, and science can be very messy, and we're waiting basically for them to have some sort of consensus.
But studying statistics, I mean, when your profession is looking at the numbers all the time, one thing that you can relate to us is we're only as good as the data we have coming in. We're only as informed as the data that comes in on this. So when people argue, well, that's not what so-and-so said, 6 months ago or a year ago or whatever, our plan changes because the information that's coming in gets more specific, or there's a game-changing event like a Delta variant, which has everybody rethink everything.
Correct.
You know what?
You wanted to go over leading cause of death. I'm sorry.
Yeah, it's okay. I was also going to say that the comments aren't loading for me. So if you see questions come up, just let me know and we can get those answered. I see Angelica Garza has a question about the 3rd booster. You can go get the 3rd booster. They're giving them out at Costco or wherever. I do want to stress this is for Moderna and Pfizer. They're obviously Johnson & Johnson was just a one-shot thing, but this is Moderna and Pfizer. So yeah, you don't have to be in, as you say, medically complex. You can just go get it. So your group is up. They're giving it out to everybody. So if you've had your 2 shots, you can go get your 3rd right now. The immunocompromised one that I was talking about, for those who have cancer, those who are on meds that would suppress it, that would be the 4th booster shot. So 2 different things right there. All right, let's talk about that. The leading cause of death in Arizona. Let's see. We ranked 11th overall. We ranked 6th per capita.
Yes.
There's no way around it. One thing we know for sure. I mean, death is permanent, and death numbers are in. And I mean, when we compare ourselves to places like we've compared ourselves a lot to Washington over the last year and a half. Washington State. Because of population-wise and scope, and it's kind of a good thing to look at. Also, Colorado was one that we compared to. But even when we're looking at those, it tells a very different story of how we approach things here in Arizona, and then what our outcomes were when it comes to death.
Yes, so we wrote a story on this. This is a report from the Arizona Public Health Association. It was done by a person who was a retired health statistician from the Department of Health Services, and they used the same formula for COVID-19 that they used to calculate these other causes of death. They pulled the other causes of death. They pulled from the CDC. They pulled COVID from our current database, our dashboard, and then did what's called a per person annualized calculation on it to get the per capita rate. And what you see here is that as their estimate is that COVID-19 is at about 177.8 per 100,000 people in Arizona, and heart disease and cancer are just under that at 172 and 171. And the reason that they are confident that this, even though the heart disease, cancer, all these numbers from 2019, they are very confident in these numbers because heart disease, cancer, chronic lower respiratory disease, all of these others are fixed to a population, and they barely change. They basically stay the same for the last 10 years. I saw a chart where they essentially cancer and heart disease interchange in their number, who's ranked higher, but they don't fluctuate as far as the raw number very much. So because it's at 177 as opposed to 172, they're very confident that COVID-19 will be the leading cause of death. Now, if it wasn't the leading cause of death, it turns out that it's not. It's the second, maybe the third. It's still going to be up there at that 177 range. So it's going to be much higher than accidents, Alzheimer's disease, diabetes, suicide, all of these others that are much lower causes of death. So it does show that what they presume. Let me see if I've got this other one. They think that there's about 35 annualized deaths from COVID-19, which is about the same as you can see from heart disease. 34.5 a day from heart disease, 35.4 from COVID-19.
And I just want to stress where people can find this chart. This is not an internal
This
one.
chart is actually, no, this is on our the story that we published at ABC 15 for the leading cause of death. This is one of the links to it, just the actual report. But I do have a specific graphic in there so you can see most of these numbers. I also have their calculation where they compared Arizona to, I'm going to use this one, Arizona to Washington and Colorado, 2 states with 2 fairly similar populations. We are a bit of an older state, but they do have a similar population. And you can see that COVID for Colorado and Washington were the 3rd cause of death in those states, and significantly less than your cancer and your heart disease. As you can see in both states, cancer and heart disease are both up there because they're slightly younger states. It still shows you how different Arizona has been. Now, Will Humble, the executive director, he has been a frequent critic of Governor Ducey, and he does believe that this is a matter of policy. We are just showing the numbers on what they came up with, and this does check out. I did replicate these numbers, and they do check out.
Speaking of policy, Washington State was shutting down more often, masking for longer, things such as that. So the different response that we've seen, they opened up a lot later. We were pretty much open the entire time. Let's see. I want to mention where people can find that. You said on our website, and just to drill down more specifically so everybody can find that, it's abc15.com/coronavirus. And that actual report that Garrett filed is right there on our website as well. If you just scroll about halfway down, you'll be able to find that right there. Okay, Garrett, when we're looking at the U.S. response compared to other places around the world, we're seeing these numbers come in, and there can be an argument whether the validity of the numbers that are coming in from countries around the world actually exists. But even if you would argue that maybe they're not reporting as many numbers as they have, we can still see that Russia and Ukraine are seeing some sort of surge, whether their surge, their full numbers are in there or not. But Russia and Ukraine are just seeing these huge numbers. Now, you and I would watch Israel a lot for how they were responding. They were very quick to respond, and we could kind of learn from some of the things they were doing there. Then we watched Europe very closely, just because if we saw sort of a surge happening in Europe, then we would know, okay, it's just a matter of time before it's here in the U.S. and then here in Arizona. One country that we have not talked about through the past year and a half that we've been reporting on this, Tonga. They just reported in their first case ever.
Wow.
So just wild that there are countries on the planet not experiencing this still as of 2021, but they just reported their first case in all of this. So with that, when we're looking at these countries, is there a place that you go or you like to suggest people go to see those numbers, especially when travel is picking back up again?
Yes, I'm going to go there right now, but I did want to just put in one thing. Someone did one of those little gotcha questions about adverse reactions to the vaccine. And so I'm pulling up the CDC website. This is just on CDC to show that, there obviously are adverse reactions and deaths to the vaccine, but that number is, as you can see, 0.0022%. Out of 414 million doses. So if you want to play the math game, it is a much safer bet than COVID-19. Even if you are in certain demographics, younger demographics, it's still a much safer bet. So I know a lot of people like that 99.9 recovery rate. So just take that to whatever you want.
And one other thing, if you have had
this.
an adverse reaction, you need to be reporting it in to that VAERS system as well.
Yeah, have the doctor do it, please.
Yes, exactly.
Too many people have been the VAERS system
Self-diagnosing.
has been there's been some issues with the VAERS system because people have been sort of messing with it. Now back to that, I'm going to go to the site that I think is one of the best comparative tools for both the states and for other countries. It's called 91DVOC. 91-DVOC.com. We've used this site several times. When we used to do this on a daily basis, we use this site. They do a great job sort of showing both the raw numbers and the per capita numbers, where you're able to sort of take everything together. So you can see newly confirmed cases by day. We were just looking at this because we were talking about Russia. You and I, before we started, in that Russia is seeing its highest number of cases right now. And we could just move right here. We can go to United States. You said Tonga, right?
They I don't even know if it'll show up on there. They literally
Tonga's on here. Yeah.
Just reported their very first case. Yeah. So
exactly.
I mean, it's so new that it might not even show up.
Here's the United States. Yeah. And we can say top 25 by data. This is just showing the top 25. This is where the US is right now. The European Union is also shown. We can look over here on the cases by day. I'm going to go to per capita for the states because I think it's just a better number. Because our states are just so different in population. It's rendering. It takes a while for it to do things now. Let me do this. I'm going to make this a little easier on all of us by changing this to 12 weeks so we can see sort of the newest numbers. You can see here's Arizona. Our numbers have been fairly constant. As we've talked about, we've had a small surge, but you can see there it's pretty even right now. You can see these two jumps right here you're looking at. This is what I was talking about the numbers, the dashboard being broken this week and last. So we've had some pretty decent jumps over these last few days, but these are administrative. As you can see, if you take those out and you flatten them out, the numbers are pretty much the same. And this is where we are. We look like we are, let me see if let's do the top 25 here, see if Arizona's in the top 25. We are in the top 25 of states. You can see Alaska's up there. Let me go to all current highlighted value. Oh, sorry about that. All highlighted data. All right, you can see, you've got West Virginia. You've got, let's see, it looks like Kansas is the last one there. That's why I need all data. Alaska is going through a bit of a case surge right now, followed by Montana, Wyoming, North Dakota. So a lot of northern states. And then we're up here pretty much at the bottom of this list. But again, this is the top 25. So, just think about that.
Yeah. And this is, once again, 91DVOC. So it's COVID-19 spelled backwards if you want to go check these charts, especially for those of you who are traveling in the next few months for the holidays and just want to see how many precautions you need to take when you're traveling to those different places.
And I see Alberto here is saying that the winter surge equals the flu. I mean, doctors are pretty smart people at this point, Alberto. They can distinguish between COVID-19 and the flu, and so and the tests have gotten better and better and better, and so there is the chances that flu is sort of overlapping with COVID-19 for people who have been tested positive and thus show up on the dashboard is very, very low. Now, there could be people out there that didn't get a test that get the sniffles and say, oh, I have the flu or I have COVID, and they have vice versa, because for some people, the reaction is very similar to the flu. But, as far as people who test, which means they show up in our data, and then not the at-home test, but an actual PCR test that they take, the PCR test does not. I know that there was some misinformation going around that the PCR test was checking for the flu. That was never the case. That was a misreading of a CDC white paper they put out, and that the PCR does not indistinguish from the flu. If you take a PCR test and you test positive for COVID, you have COVID or you had COVID. There is a chance that you won't have COVID. There's a chance that you've had COVID already because of the way that the PCR test works, but it was in your system no matter what. Yeah.
Hey, there's a really good question, one that we haven't answered in such a long time, but that we have the answer to. Robert, thank you. He's saying, could someone in the news please explain why the other day's death statistic was minus 11? We absolutely can explain that to you. It was probably on a Monday, unless it was on one of those days where the reporting system was not working correctly.
The reporting system has been a little weird, so there's been a couple days this week where we've had some administrative issues that weren't Monday, but yes, normally it's Monday. You're right.
So gosh, Robert, we kind of went over this a lot during the first year that we were on every single day. Now we're just on once a week or so. And in this case, we're only on this month. But Garrett, that's either, well, last year it was really a deduplication process of the numbers just to make sure that they didn't have an overlap. In this case, now it's more likely a case of on Mondays, when the reporting in is a little bit lower over the weekend. Do you want to give a better explanation of how that?
Yeah. So this last
works?
one, it was -11 yesterday.
Oh, it was yesterday.
Was the report, and it was very confusing because it's one of our largest negatives. Usually, when we get a negative report,
it's -1.
It's usually -1. And so, what happened? What I sort of understand based on the conversations I had with the Department of Health is that they were doing their standard, matching. A lot of times, people forget that when they do death certificate matching, they're getting it from the health, they're getting it from other county health departments as well as from other places. Hospitals, other things like that. And so because they're getting it from several places, sometimes duplicates do show up. And these are all meticulously researched by staff epidemiologists. This isn't a situation where, they just put them out. So the system could have come in and said, oh, and we did. We had 102 deaths and then 81 deaths reported the days before that -11. And what likely happened was that as the epidemiologists were researching these, they found several duplicates. It was a low reporting day anyway yesterday. And because they found several duplicates that came from those days before, duplicate death certificates, they did have to withdraw those deaths from the system. And so that does happen.
So while it feels weird, it is a signal that they are doing their due diligence to make sure that nobody is double counted in this, and that the
I
numbers.
Think people and this isn't a criticism. We all sort of, when we look at numbers, we sort of assume in most statistics, and many types of statistics out there, whatever number is being reported is like sort of a set in stone number. It's like stamped for the day. So this is the amount of money that the point of sale system collected. We collected $30,000 or whatever on October 28th, and that number likely won't change because it's sort of transactional. And what's different about health data is not transactional. And so when they report something, even though they put a number out, that doesn't mean that they're not going to go back and actually research this data. This is a living, breathing database that they're reporting on. And so things do change over time. It's not sort of transactional like money. It's these are people, and so people have to be researched. Things change. People are duplicated. They find out. There's a myriad of reasons as to why somebody will have to be a record will have to be edited, which will change the reporting data. So and again, it's confusing. I don't begrudge anybody who doesn't understand that, but we just have to think of it more as a living, breathing database rather than sort of a point of sale system.
Yeah, I know it feels weird. That's why I wanted to address that, Robert. Really good question. Those are the questions we aim to answer for you.
Amber has a good question. Amber has a good question. Do you think COVID rates will go down once children are vaccinated? My answer to that is probably not. And the reason I think that probably not is that in the age group they're looking at right now, 5 to 11, there wasn't a lot of tests for that group anyway. In most cases, COVID gets through a household. And you'll say, in my family, I have a 7-year-old daughter. Back in the winter surge, my wife and I both had COVID. We did not test our daughter because we knew that since
you have it,
COVID, the likelihood of our daughter having COVID is pretty much in the high 90s. Right. And so we did not test it. And so a lot of parents, a lot of people are making that same determination where they're not testing their kid because they had COVID or whatnot. Now, obviously, there was a surge, a mini surge, if you will, back when schools were opening where kids were testing. But that's actually quite rare. That's the only time basically during this entire pandemic where kids, not college students, were leading the numbers increasing, were those first few weeks of school opening up. And so I do not believe that when the vaccination rates for kids now, if I were to back up a second, this is a little more complicated, but we also have to think of kids as vector points and not just individuals. So obviously when a kid goes to school, if they get COVID-19, there's a chance that they are going to transmit. Schools are sort of an area where transmissions can occur at a much faster rate than, say, a grocery store. And so while my first answer is probably not, my second answer is It can't be quantified, but there is, I guess you can make an argument that when the vector points get lower because more kids are vaccinated, then it does have a chance for the numbers to over time go down. But it's going to be an over time thing.
Yeah,
Kids are
and
super complicated when it comes to COVID-19.
yeah, and will parents show up for it? That's kind of
Yeah.
the conversation too. So for those of you just joining us, the FDA did approve emergency use authorization for Pfizer for 5 to 11-year-olds. That doesn't mean it's showing up in the doctor's offices. Don't call over there just yet. It means that it's got to go through one more CDC director approval. That should likely happen. It's scheduled to happen November 2nd or 3rd. And then immediately 15 million doses would be sent out. That's how many are ready to go, boxed up. And that would mean shots are going to be available first or second week of November at this point. Again, this is going to be at your pediatrician's office, at your doctor's office, at a pharmacy, and down the road. They're talking about doing this at schools or school districts, making it an easier place for people to pick that up. That is for Pfizer. That is for 5 to 11-year-olds. Moderna, right behind them, just not at that same step just yet. Moderna is advertising a 91% prevention in infections ages 5 to 11. Pfizer, I believe, was 90%. So a really great number, a really hopeful number in all that. But it remains to be seen at this point. So then it will be sent out to doctors' offices and pharmacies.
So Hillary had a comment about COVID, bad flu, immunization. It's up, people. Why does the numbers matter? That's a decent. That's a fair question. Okay. And so Hillary, what I will tell you is that the numbers matter because if we go back to the IHME dashboard really quick, I just want to show you something. It's really comes down to this number right here, hospital resource use. I think even in the end, this is probably even more important. I'm not going to say it's more important than the death number, but I would say this is probably one of the most important metrics of COVID-19, because as you can see, one of the biggest issues with COVID-19 is that it stresses out the hospital system. Here we have our hospital, right now we've been at a sort of a quote unquote quiet moment in our hospital systems. Back in the summertime, we're not at a quiet moment right now. We're quite high, and it continues to increase. Now, if the hospitals were not designed to have 20% of their beds currently occupied for COVID-19, and they have been 20% or so basically since the pandemic began. And so this sort of creates a snowball effect in so many other things. It's not just the COVID-19 hospitalizations. It's the fact that now 20 to 30, sometimes 40% of the state's beds are not available for other things. They can't be used for other sort of procedures.
You have a heart attack and there's not a bed for you.
There are several snowball effects that happen with COVID-19 that are sort of unseen because they're not in the numbers. And the reason we track these numbers and the reason we look at cases is because cases lead hospitalizations. If the cases go up, 7 days later, the hospitalizations will go up. 7 to 14 days after that, the deaths will go up. This has happened since day one, and there's no expectation for that to not change. The rate of increase, it can be up to a dispute. Like, for example, this last surge we just had, the rate of increase for hospitalizations was not as bad as the winter surge because of the number of vaccinations we have for people over 65, the people who are the most vulnerable. But we did see an increase. And so why we look at this, we look at these cases increase and say, okay, we know that the hospitalizations are now going to increase. At what rate are they going to increase? And are we going to be at a situation again where the hospitalizations are really at the breaking point? Because really in the winter of 2020, our hospitals really did get to a breaking point. They were very much understaffed, over capacity. It was a big problem for them, and we don't want to see that again in the wintertime of this year.
Okay, let's see. We only have a matter of minutes left. Phyllis just saying she got one of her shots just a few days ago. No symptoms. Glad you're feeling good. And to all of you who've commented about either being sick or getting the vaccine, we just want everyone to feel better. That's the reason we're here, or avoid getting sick altogether. So let's see. In these last few minutes, Garrett, is there anything that we missed in all of this? I know we haven't gotten together on here in a couple of weeks just because of shifting schedules. Ingrid writes, I'm glad to be catching you two again. Thanks as always for your excellent factual information. Happy Halloween. Same to you, Ingrid. Thank you for joining us on here. That's what we aim to do, is just get these numbers out to you guys and teach you where you can find them. With that being said, Garrett, throughout these conversations in the comments, I know people that are watching later can't see the comments. If you want to go back on ABC 15's Facebook page, that's where you can find all of those comments. But a lot of people bringing up RSV and flu and COVID and all of that. And we talked about all the different tests for all this stuff. I also want to mention on AZDHS's site, obviously COVID is front and center because it is the leading cause of death here in Arizona. But there are sections that you can drill down on RSV, you can drill down on the flu, and you can drill down on COVID and find even more info. So if you're looking for that data, to an outside person, it might be a little more confusing unless you go 2 years back in the data from the flu, because that's when they're going to have a synopsis in there of what that flu season
Yeah,
looked like.
I mean,
Otherwise it's raw numbers that are hard to read.
That's another thing people, again, I don't begrudge people for this, but COVID-19 is under emergency reporting rules right now. And so we're getting these daily reports that other things don't give out. So there is no corresponding flu data for COVID-19 that would relate to the COVID-19, the way COVID-19 is being reported. The same thing with RSV, the same thing with essentially anything else. COVID-19 is unique in what people are asking for it to be reported. Everything else doesn't have the same reporting requirements as COVID-19. So it's one of those things where we sort of have to wait over time. The health department releases an annual report that's going to sort of flesh out the flu numbers and other things, but you sort of have to wait for all those things. There are some dashboards that will give you what's called the why can't I think of the number right now? It's the or the name of it. It's the system that they use, the surveillance system.
Mm-hmm.
They give you the surveillance system number, which is basically an algorithm where they use with the hospitals to figure out what they think the flu number is. But they don't give you the actual numbers until basically once a year.
Yeah, perfect. One other wild number that I saw in all of this today, Garrett, just as it pertains to the numbers in Arizona, 60% of the people that we've lost in Arizona are men and 40% are women. I found that to be an interesting number, considering I believe there are more women in Arizona than men total.
And there's also been more women who have contracted COVID-19 than men.
It's an interesting number. Fascinating. Yeah, I should say specifically 59% in men, 41% in women, but the 60-40 split is about what it is.
Yeah, I mean, really, for me to speculate as to why that is, it would be improper to speculate, but the numbers are there. We can see that if we look, let me just really show you what you're talking about. I'll show the audience here. When we go to AZDHS's site, I'm going to start with cases just because it really shows the demographics. So this is the case demographics, and you can see that as soon as it pulls up, this is the last 6 months. So I'm going to go to all time, and you can see 52% of COVID-19 cases are for females, 48% for males. When we go to hospitalizations, again, I got to switch it to all time. They made a lot of changes to the dashboard.
I saw that, yeah.
Yes. And then when we look at all time, where is male, female? This one is broken up into age groups. I don't have a full number for these right now, but if we look at male versus female, you can see just visually there are more males in basically all age groups that were hospitalized to COVID-19 than females. And we go, as I said, finally to deaths. And you can see the number flips to 60-40, like you said.
Mm-hmm.
Let me put it is on all time already. So 60-40. So 40% of deaths came from women and 60% for males. I need to move this to all time. You can see it's still tracking. I just used the last 6 months, but it's still tracking the same. It's 59% male, 41% female for all time.
Yeah. By the way, I find that banner at the top pretty helpful. I know they've switched that,
yes.
And it's probably made things crazy for you on the back end as you're taking these numbers into the newsroom to divide them up.
Correct.
But as an outsider who still has empathy for you, but also trying to find these numbers to protect myself and my family. Yeah, I kind of appreciate just the 6 month look because. Mm-hmm. You could look at the all-time look and go, okay, well, I know we're not in what we were in January of last year, but how do I make the right choices for my family?
How can I look at
Yeah.
close. Yeah, at a much what's more relevant for what's going on right now. I completely agree. So all these hospitalization numbers, everything's in a 6-month increment now. The all-time is available, but as you can see, because of the last two surges, sometimes it's better to just look at the 6 months as far as seeing what's going on right now. But yeah, all of it basically throughout the entire dashboard, they added this 6 month to all-time number. So you know we have that now.
Yeah. Gina's writing, I'm late for this. How do I rewatch it? Yeah, sorry, Gina. We just kind of like snuck in today with everybody. I'll try to repost it on my private Facebook page, which is ABC News from Katie, facebook.com News from Katie. So I'll post it there once this is all out. So give me an hour or so and it'll be up there. That's probably it for us, Garrett. I'm trying to think if there's anything else we needed to answer.
No, I mean, right now it's looking, because we were seeing signs of a surge. Now over the next 7 days, it's going to be, are we seeing a surge? Are we seeing a continuance of the plateau? Or are we seeing a surge? If cases only go up by about 1% to 2%, then obviously that's a continuation of the plateau and it changes the formulas going forward. But if we're up by 8, 15, 20% coming next week about the same time, then we're having basically the same conversation we're having today, but with an additional week of evidence that we're seeing a surge.
Exactly. All right. We'll wrap with this. Carrie writes, and Carrie, thank you for the comment. It's nice to see you two again, though I wish it wasn't necessary. We feel the same way. Thanks for keeping me informed. You've helped a lot throughout this pandemic. We are happy to help. A little bummed with this news of a possible surge today. Not at all what we wanted to report, but obviously some more helpful news for parents who were desperately waiting to get that Pfizer approval. It sounds like things should be going through next week, and we will, of course, be reporting it to you when it does. Our very latest newscast you can find at 4, 5, 6, and 10 p.m. on ABC 15. Also a 9 o'clock newscast over on CW 61. You can find Garrett's awesome updates if you brave his Twitter page. Gets a little wild over there at Garrett_Archer. All the data information as it relates to Arizona that you ever wanted to know, you can find right there. I'm on Twitter as well. At Katie Raml is where you can find me. I just mentioned my Facebook page. That's News from Katie. So Gina, I'll get this all posted over here so you can find it as well. And in the meantime, the very latest coronavirus reporting, if you aren't able to catch our newscasts, is abc15.com/coronavirus. You can also find our schools update in the schools section there on ABC 15. Thank you to Cortland, our producer this afternoon, punching up all those websites so you can find them easily. abc15.com/schools for that reporting. I always suggest you bookmark your child's school district COVID dashboard as well, so that you can easily find that information to drill down specifically to your neighborhood and your child to be able to keep them safe. And we will keep you updated. We hope to have another update for you next week. Schedules permitting, we will. And
well, I'm done with my paternity leave for a while.
Paternity leave, yes. Welcome back from that. We're so happy that you can have that bonding time. And that's it for us. In the meantime, everybody, be safe out there.